Hi, my name is Marcus Heisner, and today we're going to be going over the critical assignment for Kinesiology 557. And I have my volunteer Alejandra here, which I appreciate her for her participation. And what we're going to do first is the resting heart rate, and then followed up by the blood pressure. So we'll have a seat here, and first we'll be taking that radial pulse of the right arm, and she's been resting for 5 minutes, so it'll be a good resting heart rate and resting blood pressure reading. And some common faults could be positioning of the fingers. Where we want the fingers is right on the medial aspect of that wrist, and then you can wrap the thumb around and just kind of have a good grip there. And then we'll be doing a 30-second reading and multiplying by 2. So if you could just come forward, and we'll start now. And with that proper grip, you want to make sure you feel the pulse, and that's what you're counting for the 30 seconds. And I got a reading of 40 in 30 seconds, so multiplying that by 2 would be 80. So resting heart rate of 80 beats per minute. And now we're going to be doing the blood pressure reading. So I have my blood pressure cuff here with the sphygmomanometer attached, and we're going to want to be taking the brachial pulse here, which is located right here in the medial aspect of the elbow. And we're going to want to have that artery mark of the blood pressure cuff right at that brachial artery. You want to make sure you still have room to access that with your stethoscope. And then I'll place the dial of the sphygmomanometer right above that artery mark. And with the sphygmomanometer, you turn the dial all the way to the right to begin to pump it up, and then you slowly turn the dial left to get the reading of the blood pressure. And what you're looking and listening for is that pulse that you start to hear and see. And so I'm going to put on the stethoscope, which you want to line up the ears along with the ear canal, and then you're using the stethoscope right at that brachial artery, and you turn the dial all the way to the right, and then we're going to begin to pump up, and you generally want it around 160 to 200, and then I'll start it at 180, and then you're slowly going down from there and looking for that and listening for that pulse, which I start to hear there. And I start to stop hearing there. So that gave me a reading of 122 over 82, which is right around the perfect range, which normal reading is generally 120 over 80. So thank you so much, and we'll go on to the next video. So I was thankful to get access to my blood pressure cuff and stethoscope, as I wasn't able to for my previous assessments. And another thing I didn't quite do properly for my previous assessments was measure the spots for the next aspect of the critical assignment, which is the body composition, which the 3 spots that we will be going over for the female will be tricep, suprailiac, and the quad. And so for that, if I could have you turn to the side, Alejandra. I have pre-marked the spots, but just to kind of show you how I got those markings. You start at the acromion process to the olecranon process, and you just measure what the midpoint would be, and I have that marked there. And then if I could have you lift your shirt just a little to show that suprailiac spot, go right above the iliac crest and just make a mark there. And then to show the thigh, could I have you turn, Alejandro, to face the camera? And so you start at the hip joint, kind of ASIS, and you go to the kneecap, and right at the midpoint there, which I have previously marked. And so what we'll start with is the tricep measurement. And so for that measurement, what I will do is I will first get in about 3 to 4 inches of a pull, and then come in with the calibrator, and I have a reading of approximately 16. And now we're going to be going to the ratio at the suprailiac. So what I'm going to do is go to a knee here and grab same amount of a pinch and come in with the caliber, and I get about 16 as well. And then now we're going to go down to the thigh, thank you, and I'm going to grab the same amount of a pinch here and come in with the calibrator, and I get a reading of 18 there. And what we'll go to now is the waist to hip ratio, which for that reading, you're going to be assessing the thinnest aspect of their waist as well as the widest aspect of their hips and comparing the ratio. So what I'm going to do now is, if I could have you lift your shirt just a little higher so I could assess just above the umbilicus kind of what that thinnest aspect is, which for Alejandra is about right there. And what I'm going to do is actually pass this to you, and if I could have you pass it to me behind you, thank you so much. And then I'll make sure that I have the right area, which I do. A common fault could be having the areas mismatched or not even here, but I have them even. And what I have is a centimeter reading of 78, as this is 4 off here in the beginning. And then the widest aspect of the hips, could I have you turn to the side? And again, knowing that this is 4 off at the start, we're going to measure again the widest aspect. So could I have you pass this to me? Thank you so much. And then I'll gauge the widest aspect of the hips and buttocks area, which again, you want it even. That's a common mistake. And with it even there, I gauge that to be the widest aspect. And so with it being 4 off, it would be 106 centimeters. And that would conclude the waist to hip ratio. Thank you so much. All right, so now we're going on to the next aspect of the critical assignment, which is the sit and reach test for flexibility. And what we'll be doing is, I have the measure marked out to 15 inches here with the tape measure, as you can see. And so we're going to be having the backs of our heels right at the 15-inch mark. So I'll show you that now. And then that'll be the starting position with the feet about hip width. And then you want your hands stacked on top of each other. And then for a proper test, you'll be breathing in through the nose, And then breathing out through the mouth as you go. And then you hold for about 3 seconds. And you come back up. Some common faults or common mistakes would be as they go up, they let their knees bend, or as they go up, they try to extend further with one arm than the other. Another common fault would be if they went out and began to pulse at the end to go further. You just want to go out and hold for about 3 seconds at the limit, and then you'll come back up. We'll be taking the test 3 times, and Alejandra's going to demonstrate the test here for us. And so with the backs of the heels right about there, and then hands stacked on top and on the tape, you're now going to take a big deep breath in through the nose and out through the mouth as you go forward and hold at the limit. And go back. Take a breath as long as you need. Take a break, and then we'll do one more breath in and out. Hold at the limit. Come back up. Controlled. And when you're ready, breathe in and breathe out for the last test. And hold at the limit. And slowly come back to the starting point. I had a little bit of help with her nails because the first one was about 15.5 inches, second one was about 16, and the third was 17 inches. So we'll take the best of the 3, and that'll conclude the sit and reach test, and we'll now go to the rest of the flexibility portion for the right side of her body. And now for the flexibility of the right side, we're going to be mainly focusing on the elbow, shoulder, knee, and hip. And I have Alejandra in position here. And what I'm going to start with is using the goniometer to assess the ranges of motion of all those aspects. So going to be having the axis of rotation right at the lateral epicondyle, which I palpate to be right there where my thumb is. And then I'm going to have the stationary arm in line with the acromion, and the movement arm in line with the radius. And so go ahead and bend the elbow now, Alejandra, as much as you can. And I got a reading of 130 there on the bottom. Slowly relax it back down. Now I'm going to be assessing the shoulder. And for the shoulder, I'm going to be having the axis of rotation of the goniometer at the acromion process. And the movement arm as well as the stationary arm are both going to start in line with the iliac crest and the radius here, and then the stationary arm is going to stay, and the movement arm is going to follow along with the rest of the shoulder. So go ahead and begin to lift the shoulder up into flexion, keeping it straight, just going up as high as you can, all the way up. And what I've got is a reading of 108, so go ahead and come back down. And now I'm going to assess the range of motion of the knee. And the axis of rotation is going to be at the lateral condyle of the knee, and I feel that to be there. And then with the stationary arm, we're going to have that lined up with the greater trochanter. And then the movement arm is going to be with the lateral malleolus. So if I could have you bend the knee, Alejandra, into flexion as far as you can. Good. And I have a reading of 124. So go ahead and straighten it back out. And lastly, we're going to do the hip. So I'm going to have the axis of rotation here be at the greater trochanter of the hip and line up the stationary arm with the acromion process there. And then the movement arm is going to be lined up with the knee and kind of lateral aspect of the knee there. Lateral malleolus to begin with, but it's going to follow the knee. So go ahead and bend the hip into flexion, Alejandra. Good. And I have a reading of 96, and that will conclude our flexibility assessment of the right side. And thank you so much. So now for the next portion of the critical assessment, we're going to be going over the ACSM push-up test. And for that, there's two ways to do it, full push-up and modified push-up. So I'll show the full push-up first. It'll be with the hands hip width, feet hip width, and you're in the full position of a push-up. And then you're bending at the elbows and chin to chest, and then coming up. Chin touches the mat, and you're coming up. What you don't want is your stomach to touch the mat, and you also don't want your butt to be too high as you're going. You want everything nice and straight and controlled for the push-ups. And we'll just do as many as you can until you lose form or can't do any more. The modified is very similar, but on the knees, and you want everything straight. Same idea with this position, hip width with the hands, hip width with the knees, and you don't want the butt too high, and you're going down like that, and you don't want the butt too low, and you're just going down like that. Same idea with the stomach. You don't want the stomach to make contact. You just want to touch the chin and come back. And then same idea, we'll do as many as we can until we can no longer keep form or can no longer do any more. So I'll have Alejandra, if she's ready, perform the test now. So she'll be getting into that push-up position. And then get the hips a little lower so you're nice and straight. And then from here, go for it when you're ready. 1, 2, good job, chin to chest. 3, chin to mat. 4, 5, very good. 6, 7, 8, make sure the chin touches the mat, keep that form. 9, good job. So she got 9 there. Now we're going to be going over the curl up test, and for that I'm going to get a metronome ready here, and the metronome's set at 40 beats per minute, and that will be the pace that we keep as we go into that curl up position. And the starting position for that curl up is on the back, knees bent, and you want your fingertips at the start of that 12 centimeter mark on both sides. And then once you're ready, the idea is to hit the end of that 12 centimeter mark and come back at each metronome beat. So, show you now what that looks like. And some common faults would be to not reach the 12 centimeter mark, as well as to not keep up to the beat like I am now. You want to stay on track with that metronome. And as soon as you kind of lose that track, then you're done there. Another common fault would be if you reach with one side but not the other. So what you're wanting to do is just get to the end at that beat and come back. You're only doing as many as you can until you lose the beat or lose the form. So I'm going to have Alejandra come in and help me with that testing. So if you can get into position. And knees about hip width. Hands look pretty good there. And then I'll put my hands at the end of the 12 centimeter mark so she knows as well where to touch. And take your time, but when you're ready, make sure you stay on that beat metronome for each rep. Five, 6, 7, 'and I'd say you lost form about there. And that will conclude the testing. What we will do now is take the resting heart rate and blood pressure. So I'll turn this metronome off and have a 30-second timer here. And if I could have you rest your right arm there. And I got 43, which would be 86 beats per minute. And now I'm going to take the final blood pressure. And starting now, pumping it up to between 160 and 200. And slowly releasing from there till I hear and see blood pressure reading. Which I see it there and hear it as well. It starts to go away there. So I got a blood pressure reading of 128/78, which again is right near normal limits, as 120/80 is ideal. Thank you so much for your time, and I hope you are staying safe and healthy.